For over 50 years, MBF, the Medical Benevolence Foundation, has been engaged in a unique ministry. It is a ministry of connecting people and resources to create sustainable, locally owned healthcare missions in developing countries. These missions deliver not only quality patient care, but also an introduction to the gospel of Christ and spiritual ministry training for medical staff. MBF's impact is felt by individual and church donors, by churches in developing countries, by healthcare students and staff, and by the patients who receive spiritual hope and physical healing because of MBF. This is just one of MBF's stories of impact.
Maternal health risk in Africa is still the highest in the world. A young woman named Kalanga faced not only the dangers of giving birth, but an unimaginable violence in the Democratic Republic of Congo. 24-year-old Kalanga was innocently caught up in a military conflict in a rural part of DR Congo. Ongoing violence in parts of the country caused by more than 100 armed groups terrorizing rural communities. The Marisha who took Kalanga did not see her as a person, but as a possession. She was treated like plunder from their raid and was repeatedly raped. When Kalanga was freed, she eventually came to an MBF partner hospital. She was alone, without any money, pregnant, and in labor. The birth ultimately required a C-section to save Kalanga and her baby. Because of the generosity of others, Kalanga received the treatment she and her baby needed without having to pay anything. Today, she has a little girl that she calls a blessing. She says that God took the worst experience in her life and has turned it into a lifelong blessing. Having the resources and the specialty services needed to address cases like Kalanga's will save the lives of other babies and their mothers in the future.
Thank you for taking the time to listen to one of MBF's stories of impact. Your gifts help MBF continue the good work that was started in 1963 and bring healing and hope to the most vulnerable for generations to come.